So I want you to think about a patient like Elisa here. And I want you to put on your diagnostic hat. This is a full cone beam, and I'm going to show you everything that's pertinent to her case for you to diagnose it. So you're looking at her, and you're going to come up with a plan to treat. I want you to think about what your diagnosis is for her. Look at her airway, look at her malocclusion. Think about what your treatment plan is going to be. And I want you to think about what you expect the outcome to be. This is a severe class 2 division 1, correct? So think about what appliances you're going to use, what type of iatrogenic effects you might get at the mandibular incisor level, all those things. Now what we've been able to do is we've been able to put all of this content into a place that's accessible to you on any device on the platform Polaris. And I want to show you this case because it highlights something called Polaris Insight, which is a feature that we've just developed, which allows you to look at everything, including airway and malocclusion, and share your thoughts. And we thought about doing this live here today because it would be really interesting to see what the room thought about this case and about the airway. But here you're able to go through your diagnosis and your treatment plan and share your information about what your brain is thinking relative to this case. Because we're here at these meetings, we're seeing all this wonderful work, whether it's airway or orthodontics, and we need to take it back into our practice and implement it. We need to figure out the what, and we need to figure out the how. And so what this feature allows us to do is collaborate with each other, whether it's a group like this or it's just colleagues that you know. So you can share all this information we're learning about airway. Like I want to share cases with Dr. Liu and Dr. Yoon because they have these insights that I don't have. I want to learn them, and I want to understand them, and I want to get better at mine. So if you're able to share your knowledge, what happens when you share that insight, you get to see exactly what happened on that case. And you get to see exactly what happened to that airway. And you get to see exactly what happened to all of the anatomical structures in a 3D world, and you can do that on your phone. And that is going to accelerate the learning for us. Because I want to take all this information that I'm getting at this meeting, and I want to put it in my practice. And it's hard to do unless I have a place to exchange, because you hear these ideas, and it's difficult to share them with each other. When you have data that's used in smart ways, and this data can extend to AHI scores and velocity studies and all the wonderful research that Dr. Moon showed us yesterday. All of those things should be part of what we're sharing all the time. And when you can see all of the recipe of how these cases are treated and how airways are addressed and how malocclusions are addressed, and look at volumetric images. Here what's really exciting to me is looking at the difference of what people said and mandibular superimpositions versus anterior cranial base superimpositions, digging into discussions with colleagues that I know are orthodontists because they're verified, becomes incredibly powerful. Polaris Insight becomes very addictive. Unlocking these cards and seeing results and involving yourselves in discussion is pretty exciting. One case a week will get you a tremendous continuing education in your own brain. I don't think you'll be able to stop if you're anything like me. We think this is like a global study club that fits in your pocket. And full disclosure, the only reason I'm talking about this is because I am the CEO of Orthoscience, and it has caused me to learn so many things in the shortest period of time. I want orthodontists to learn things faster than we're learning them right now. I don't want people to have to go through my arc of 20 years of mistakes to learn things that I'm learning now. We're trying to speed that up. And now when we can look at soft tissue changes in ways that were never possible with cephalometrics and panoramic images, and now we can add sleep data, and we can add airway velocity data, and all of these things come together, we're going to advance much quicker. There's so many ways to dice and slice this data. So here's where we are in 2019. I live in a 3D world all the time. A lot of people, when they first get into three-dimensional imaging, our tendency is to dissect out a cephalometric X-ray and a panoramic X-ray. We don't even know what that is in our practice. Everything on our screen moves, so it's all volume all the time, and it's very informative, and it changes the way I think.